Hello, everybody. This is Tasharia,
And I'm Tasha,
and we're the Turners.
Turner Talk Podcast.
Welcome to the podcast. Thank you so much for being here.
Mhm.
All right. And today we have Dr.
Tanisha Guy.
You got to come in with it. You got to come in.
You
I say
know,
doctor. You know, okay,
oh,
your timing is slow. Okay.
I'm a little slow. Sorry about that. Plan.
Y'all know we be silly on here. So now today we have Dr. Tanisha Guy, and we just excited. I've been talking about this all week long. I was like, okay, we got the confirmation, we got the go, and I was like, y'all, you don't want to miss this podcast because she has over 20 years experience in counseling. Like she's award winning. Look, I'm throwing it all out there. She's award winning, has an award winning therapist practice. Yeah, just not award winning counselor. So this is the real deal, Holyfield. So I'd like for you all to welcome her in. If you have any questions, please don't hesitate to leave them in the chat, and we will be sure to ask her as the show goes along. So Dr. Guy, will you tell us more about yourself, please?
Sure. So do you want current, you want past, you want degrees, you want license, what you want?
All of it.
Just a little bit, tell the people a little bit back how you got started, like what made you become a counselor. Now you teaching people how to do what you do, build a business. Oh, yeah. I just anything and everything.
Oh, sure. In a nutshell, so do you guys remember the show? And whenever I tell this story, I just be like, oh my goodness, I'm just dating myself. But do you guys remember the show Growing Pains?
Yes.
And the dad on Growing Pains was a shrink, right?
Mm-hmm.
And so I remember watching the show as a kid saying, oh my goodness, I'm going to be a shrink. And then as I got older, I realized that shrink was probably not the best term for someone who was a therapist. And I realized I wanted to be a therapist. So I knew early on what I wanted to do. And even when I was in high school, people always talked to me about their problems. And I was like, I can't help you. I'm trying to figure this thing out called life myself. What is wrong with you? So it just made sense that when I got to college that I would major in psychology. And I thought that I wanted to be a psychologist, but I really didn't understand fully the mental health profession. And so once I graduated, I am a graduate of HBCUs. Big up to anybody who went to an HBCU.
Right.
I graduated with a degree in psychology, and I thought I was going to go on and become a clinical psychologist, but it was a better fit for me in the field of counseling. So I did get my master's degree in clinical mental health counseling, went on to get a PhD in counselor education and supervision with an emphasis in marriage and family therapy. And after practicing in the field for a while, I went back to school and got an MBA and a master's in entrepreneurship and leadership so that I could understand the business side of running a practice a little bit better. So education-wise, that's kind of my background. I am a national board certified counselor. I am an LPCS, which is a supervisor in the state of Texas. And I've been in private practice for about 14 years. And my practice is specialized transformation counseling and consulting, where we do individual, group, and family therapy. And I am also a full-time professor. So I've been working in the mental health field on both sides. So I've been doing therapy, I've been supervising clinicians, I'm teaching students, and now I have made a shift and I've decided to step outside the realm of actually working with clients for mental health service. And I'm starting to work with therapists to help them build private practices. Because as we were talking right before the show, what COVID did is it brought to life the world of mental health to everybody. And current trends are stating that by 2036, we are going to have a shortage of therapists. They're just not going to be available. And the reasons why they're probably not going to be available is because they're retiring or they're either leaving the profession just because of their job dissatisfaction. And so one of the ways that I think I can give back to the profession is by helping therapists build practices so that they can invest longer in the profession, because we're definitely needed, especially those therapists that look like us and that are people of color. Because one of the issues that I get all the time is I want to go see a counselor, but where do I find the Black therapist? How do I find you guys? So that's kind of me in a nutshell. I'm excited about this transition over to working with therapists to help them build a practice. But anytime I get a chance to talk about mental mental health. That is my wheelhouse. I'm like, sign me up. Let's get at it.
Yes, you have a couple of books too, like Building Practice in 30 Days.
Yes. So I do have a book called Private Practice in 30 Days. And everything that I know about building a practice, I put into this book and was like, look, if you need some help, you can't come work with me directly one-on-one, at least pick up the book. Let me get you started. Let me give you a blueprint. Because when I started my practice, one of the things I realized is I knew therapy. I knew how to work with clients, right? That's what my program taught me. But I didn't know how to be a business owner. I didn't know what a tax ID was, an NPI, none. I didn't know any of that. What was a Paydex credit score? And so I had to learn as I went, and it can be frustrating and difficult. And so I kind of want to remove that process for other therapists who are starting and give them a roadmap. So if you want to do it, it's laid out for you. Just follow the blueprint and launch that practice.
I have a question.
Book,
sorry. Yeah, she was about to say something. Talk about the second book. Come on. Sorry, go ahead.
Yeah, and then the second book, so that book is more for my therapist, but then I also I do couples counseling. And so what I would constantly hear is I would always ask my couple, so what do you think your chief complaint is in your relationship? Hands down, couples say, well, we don't communicate well. We got communication problems. Right. So I would listen, and after a while I was just like, no, y'all communicate. You communicate just fine. What you don't do is you don't listen. I wrote a book to teach people how to listen, because what we're very good at is we're hearers. We hear sounds, right? But we don't listen to engage in the content. And most often we're listening to respond to what you're going to say, but we didn't finish hearing what you said. So I wrote the book to help people improve how they listen. As a therapist and anybody who is in the mental health field, we are taught how to become active listeners, right? People will say, oh, I'm a good listener. Girlfriend, no, you're not. You're a good hearer. You hear that sound very well. But if I ask you, what did I just say? You can't repeat it back to me because you were hearing and you were not listening. So that's what the second book is about. It's called Stop Hearing and Start Listening.
I know that's right. Already, when I read the bio, I was like, I think that one up that one.
Because she's a good. Just kidding.
I ain't say nothing.
Now I'm one of the people, like you say, I'm listening, I'm hearing, so I can respond. And she's talking, I'm already getting I should have been a lawyer because I'm already getting my defense ready.
Yeah. And you said it exactly. It is a defense. So you completely miss what she's saying so that you can respond with compassion, empathy. You're like, I'm about to defend my point. Let me tell you things too. That's not what I said.
Yeah, check the thing.
And you're absolutely right. That's one of the biggest problems, I think, in probably a lot of relationships.
And that's not just interpersonal. I mean, this is in business and
all types of relationships.
Yeah, exactly. I mean, even at the stores, people don't listen to each other. Okay, I'm sorry about that. We have to get that straight. Okay, you go ahead with your question.
In the opening the practices or whatever, do you have to have a degree? Can you just open it and have other licensed therapists working for you?
Absolutely. So in order to open a private practice, you do not have to have a license, right? You just need to be a business owner who decides to open the practice. Once let's say someone who doesn't have a license decides, hey, I do want to have this practice. I want to be able to provide counseling services to the community, but I'm not licensed. So I'm going to open this practice, and then I'm going to recruit therapists to work at my practice, whether they're psychiatrists, therapists. You don't have to have that license. Now, it helps to know a little bit about the mental health profession, but one of the biggest downfalls that I've seen since I started my practice is that individuals who open their practice, when I opened mine, they're not open today. And not because they're not phenomenal therapists, but they were horrible business owners. So if you have a background in business, by opening up the private practice, you can really create that foundation that therapists don't have, but yet you can also provide a service by bringing on trained therapists. And so it's definitely doable. I wish more people would do it, because there are a lot of therapists that want to work in private practices. They just don't want to have their own.
She has a degree in psychology and mine's in business. So I was telling her, I said, we should look at opening a practice, especially for, like you and I was talking, to help kids of all age and not just at a certain age, because right now that's the biggest problem too.
Absolutely.
Age.
And working with children, and I don't know if I can talk about that child piece, working with kids and mental health, but that's really a specialized area, right? And so when you have a child 7 and under, you have to be very meticulous about who you work with or who you have working with your child. Because I can tell you, oh, I work with kids. Well, I took one class working with kids, and now I'm telling you that I can work with kids. You really want to find someone who is a certified play therapist, because talk therapy doesn't work with small kids. So if I'm in a session with an adult, we're having this conversation back and forth, it's talk therapy. But if your child is 7 and under, we really need to be doing play therapy. I need to be on the floor with these blocks, these dials. I need to be seeing you engage in your play. And this is how therapy looks for smaller children. But that's not always the case. Some people will just say, oh, I like kids, and so I'm going to work with kids as a play therapist, and they're not certified.
And there's not a lot of play therapists out there.
True.
At
we
all.
have actually, the University of North Texas developed play therapy, and some of the best trained therapists are coming out of UNT. And so in Texas, I'm in the DFW area. We do have some phenomenal certified play therapists, right here in Texas, but people don't know about them, and they don't even know that they should be looking for them, right? Because they're like, oh, I just need a counselor, right? Because I went to this person's website and they say they work with kids. I see my child age. Let me book an appointment. Really, if your child is 7 and below, it should be a certified play therapist. And one of the reasons why it should be a certified play therapist is because you're probably going to need your child to be assessed. And if somebody is assessing your child and going to give your child a diagnosis or a label, you want that to be an accurate one, and not someone who is basing what they're seeing off of their training and experience with an adult, because it's quite different.
Yeah, because a lot of them, like, were saying they can do things remotely. And I was like, well, like with our child, remote, I said, no, he really needs to probably be seen in person, because sitting still on the, we had that happen with a therapist. And I was like, okay,
And
this probably not
showing
the
post.
He was like showing them, this is my book, and he was going on and on. But she asked me a question earlier, so I'm gonna go ahead and let you address this question. I was like, why are you asking me? We about to have Dr. Guy on the pocket. She said, so what's the difference between a therapist and a counselor? I was like, here we go.
That is such a good question.
The answer. I'm like, you got Dr. Google over here.
Okay, so that is a really good question, right? So therapist that's how I can describe it is, there's an umbrella, and we're using therapist as the umbrella. And underneath this umbrella, depending on your training and your degree, you're going to use a different term. So underneath this therapist umbrella, I identify as being a licensed professional counselor. That's my degree. That's my licensure. Somebody else might identify as being a psychotherapist. Maybe it's someone who has a master's. They're a licensed social worker. Maybe they're a licensed marriage and family therapist. So they use psychotherapist. Or maybe they're a psychologist. So the term they are identifying with is a psychotherapist, but they're all falling underneath this umbrella that could be called the therapist umbrella. So to help people, these are individuals that have a master's degree or higher and a license. So that's why you'll hear people saying, I'm a therapist, I'm a licensed professional counselor. And when I let people know that I am a licensed professional counselor, I am very clear in saying licensed professional counselor. And the reason for that is the term counselor is generic. Anybody can show up on social media and say, hey, I'm a counselor, right? Like, I can call myself a counselor. I can do coaching underneath the title of a counselor. But it's very important to know this individual is licensed. So those are the LPCs, those are the LMFTs, those are the master's level licensed social workers. These are the individuals that can practice with a master's level degree. It is called our terminal degree, and we hold a license. And then you have your psychologists who practice with a PhD, and they're able to do psych testing, which I cannot do as a psychologist. Social workers cannot do. You need a psychologist to do specific psych testing. Your psychiatrists are your ones who have a medical degree, and those are the only ones that have an MD. They can do both. They can do the testing and they can do therapy. So I'm glad that you asked that question, because people are not really clear on who are the providers, what do I need. So if you're looking for someone to do a psychological evaluation, like a full battery of tests, you should go to a psychologist. If you're looking for someone to determine if you should take medication and what medications you should take, you should go see a psychiatrist, or you can also see a nurse practitioner. So that's kind of the breakdown of the titles.
And see, I was saying, I have a psychologist I see, and they recommend the medication, and then I go to a doctor to get the medication. You know.
Now, do you go to your primary doctor? Do you go to your PCP, or do you go to a psychiatrist?
I go to a primary doctor to get the medication.
See, I have a psychiatrist.
Find a psychiatrist. I know you love your PCP. Y'all got a relationship. Find a psychiatrist. Remember, PCPs, even though they can prescribe medication, that's not their specialty, right? They're coming in, or you're coming in and you're saying, yeah, I got these symptoms. And they're like, okay, well, I know you can take this particular medication for antidepressant or anxiety, so try this. And sometimes it works. But if you're looking for medication for psych, go to the specialist, go to a psychiatrist, or see a nurse practitioner.
Because I had, the doctor that I had went to at first when I started seeing the psychologist, and he was like, well, you know how you get over it? Okay, how? Stop thinking about it. Dude, if it was that easy, wouldn't nobody? And I'm like, you don't realize how close I was to flooring you. Just by, just at that moment, I had to click back into reality. Like, dude, if I could stop thinking about it, I wouldn't need to go to you or nobody else, And I thought that a lot of people maybe not go because of that stigma and you telling somebody, well, don't think about it.
Yeah.
Like that to me was horrible.
It's a horrible experience. But sometimes you have to go, even with like any type of doctor or physician or whatever. Sometimes you got to go through a few bad frauds. Because I'm telling you, I've been going to counseling for 20-some years, counselor, therapist, life coach, health coach. I'm talking about, I need coaching, maybe. I need somebody coach. Because I feel like you put it a lot on our friends and our family, and they're going through their own thing. They haven't been trained on how to deal with what they're going through. Nor not much just to try to help you. You putting all this on them. And when you go to someone who has been trained, then they can actually help facilitate the process of you helping yourself, And
I'm so glad that you brought that up, because I cannot tell you guys how many times someone has showed up in my office and they're coming because they had a horrible experience with a past therapist and they quit therapy. They was like, oh, therapy is horrible. Therapy doesn't work. And then because their issues got progressively worse, they decided, let me try this again. And they realized it wasn't the field of therapy. It wasn't counseling. They just had a bad fit, right? And so we're all trained differently. Many of us use a specific theoretical orientation to guide our practice. Some of us are more direct, like when he just said, stop thinking about it. Some of us convey a little bit more empathy. And so you really have to find what's a good fit. Do you want someone who's going to do this? I hear you. Tell me more. Okay, I'll see you next week. Or do you want someone who is going to really assist you in creating a change of thought process? When he said, just stop thinking about it. Well, that's one way, but the other way is, let me walk you through, how do you change your distorted cognitions? How do you address if this is rational or irrational? So it's really just finding a good fit instead of just giving up completely on therapy.
And that's true. And like we were talking about earlier, like this time of the year, and that was one of the reasons we was wanting you on too. For years, you've heard that during the holidays, the suicide rate is extremely high. It's extremely high, or it's more heightened than other times of the year. Why do you think that is, and what can people do to try to get in a better place during this time of the year?
Because I don't think it's all seasonal. What they call it, seasonal affective
disorder. And so it's not, right? And probably right around the 1st of October, I started doing videos about seasonal affective disorder, just because, all right, some folks, the time is about to change. It's getting darker a little bit earlier, and they didn't notice that their mood was starting to change as a result of that, right? So I was like, let me tell you what seasonal affective disorder is. It's the change in your mood due to the fact that it's getting darker earlier. Well, some individuals do struggle with that, and they don't know what it is. But the other thing that happens around this particular time is the holidays are coming up, right? And so when you think about some individuals, they've experienced some pretty traumatic childhoods. But what do we do around the holiday? We get with family. Who was the predator? That family member.
Mm-hmm.
Who's going to be sitting at the table for Thanksgiving? That predator.
Mm-hmm.
Right? So that's one of the reasons why people struggle with the holidays. Or another sometimes is just people have lost loved ones close to that particular holiday, whether it was a year ago or 10 years ago. It brings up those difficult memories that here is another holiday that person won't be here with me. So people begin to experience what looks like a sign of depression, which is seasonal or could be seasonal depression, could be situational depression, or for some people, it's just their clinical depression getting worse.
Oh, wow. And I have a question. Do you think some mental illness is caused by traumatic of the events, or some of it is you're actually born with it? Because it's like, I don't feel like I was born with, what I go through. I got PTSD, anxiety, depression. I think it had to do with what I went through. I don't think I was born with it. Do you think that that's possible?
I think some people born crazy, Dr. Guy.
So, I don't know any crazy people, but I do know some people that have some mental health.
There you go.
So that's another really great question. 3 weeks ago, I did a series called The Power of the Womb. And I talked about how as women, when I did the physical, like when we're physically carrying babies, right? Whatever we're experiencing in real time, our child is experiencing the same thing. So if a woman had a traumatic pregnancy, she was arguing with her mate, there was a lot of yelling, maybe there was even some physical aggression, maybe she was struggling with her own mental illness, the baby is experiencing that in the womb, right? And so there are studies that have shown that babies who experience traumatic births normally show up with a different temperament. They're cranky, they're colicky, like they're the irritable babies. And so the studies are saying that your pregnancy is showing up in your child in their first year of life, right? So does that mean that you passed your trauma on to your child? Yes and no, right? Because they're hearing. This is the same reason why pregnant mothers will play orchestra music or certain sounds, because they're soothing their babies, right? And so to answer your question, I don't think I was born with PTSD. You weren't born with PTSD, but what we are all born with is a predisposition for something. So the way I explain it to my clients is mental illness is like a light switch. And we're born with that light switch turned off. And then depending on our environment, how it is nurtured, then that light switch is turned on. So let's say you're in an environment that has no trauma, you have nurturing parents, they're supportive, they take care of you, then the light switch doesn't get turned on. But let's say mom is busy because she's working, dad is absent, whatever the case may be. You had a volatile childhood, maybe there was one traumatic experience that became the trigger that turned the light switch on. So it doesn't necessarily mean that you inherit it, but we all have a predisposition. Just like some of us have a predisposition to be diabetics because our grandmother, great-great-grandmother, great-great-great-great, down all these folks had diabetes, right? And so does it mean I have to have it? But my chances of having it are more likely based on my lifestyle. And sometimes my lifestyle doesn't even control it. It just is, because it is literally in the DNA. And mental health is no different.
Oh wow!
Yeah, because you get assessed, they're like, oh, do you have any past history, or your mama, daddy, sister, brother, cousins have any past history of these issues, whatever.
And that's why they're asking that question, right? Because you can say, well, I don't know. Like when I ask that question to my clients will often say, well, my mother struggled with depression, or my grandmother struggled with this, or my dad, or my uncle, and so then they'll follow it up with, but I don't struggle with that. It doesn't matter. It's still a mental health issue, right? So for your grandmother, it was depression. For you, it's anxiety. For another family, it was schizophrenia. It's still that predisposition that you have to have some type of mental health illness.
I was talking to her aunt a couple of weeks ago, and I was like, depression, I think everybody has been depressed at a time or so. But it's some people that can't snap out of that depression, that need medication to bring them out of it. And some take it to the extreme to where they commit suicide.
That's the word. You can't say that word on there. You got to say S word.
S word.
The S word. The S word. So the way I talk about depression, especially with my clients, is, and you're exactly right, that at some point, as long as you're going to keep living, you'll probably experience depression, right? And you're experiencing depression because there's a situation happening. Lost a job, lost a loved one, struggling in your relationship. All those things can trigger all of the same symptoms of depression. There are 9 symptoms of depression, right? But that's specific to that situation. That's one example. And then here's someone who shows up, they have a great job, their relationship is great, but they still just feel blah. They still report the same 9 symptoms that this person over here, who life is literally falling apart, is experiencing, but they can't figure out why. In that particular situation, we're talking about someone who struggles with chemical depression, which means the brain makeup is causing the depression and is not specifically related to an event, which is why medication management can be so effective. But as a licensed professional counselor, I always talk about skills over pills. Let's try this out in therapy. Let's really do the work. Let's get down in the Dougie and figure out what is creating this. Because oftentimes you will hear people say, just go get medication. That's like saying, I have this open gash on my leg. I probably really should get stitches. And you say, girl, just put a Band-Aid on it. It's still bleeding out. Girl, just put a Band-Aid on it. But you don't want me to go get stitches. You want me to clean that out. You don't want me to heal that. Girl, no, just keep getting them Band-Aids on it. That's what it is when people choose medication and not therapy. It's really the combination, in some cases, of both that are going to give the most effective results.
I think that medication has been given a bad rap. I said sometimes some people, depending on the situation, may need some medication so they can actually do the work. There, they can get into a frame of mind to actually be able to do the work. Because I had to do that at one time, and that's what I want to kind of talk about in this is like a lot of times when we go to therapists, we're looking for somebody who look like us, no matter who you are and what background that you have. You're looking for somebody who look like you. Like I was telling this last podcast, I went to a nutritionist and I was like, oh, she don't even look healthy. What am I? We were somewhere and somebody said, here's a healthy cookbook. I was like, you don't even look healthy. Are you making these recipes? If you're making these recipes, I don't know if I'm gonna make these. So, but because I think a lot of in the past, the therapists, the therapy umbrella has been framed in a way that it didn't reflect the complete population. Is there a way to find? Because I know you look on your insurance thing and it doesn't say specifically.
Here's your African American.
I was trying not to say it like that, but. Right.
Yeah, you can look specifically for an African American provider, right? Like, and I don't know if people know that when you're calling up your insurance company, you can say, hey, this is my zip code. These are the things that I want. I want an African American woman or male. I want this person to specialize in this. I want them to have evening hours. You can be that specific if you call your insurance company. And there's a list there. Like when we get credentialed with these insurance panels, they know all of that information. So I just don't know if people know to ask.
Exactly.
Yeah, we didn't. Did you know?
I did, because I be checking. And this is the thing. And I think people want somebody to relate to because they like, okay, I want someone who's Christian so they can, go, really relate to their background or whatever. But with insurance, even on some of the websites, you can, find specifically, if that's what you want to tap into. And I feel like a lot of people who say, how can you relate to me if you haven't experienced, you haven't lived like I was like, I don't care who you are. Everybody, I mean, like, you have to believe in their expertise when you go and really be open and receptive to it, or it's not going to help you. That's what I think.
Go
ahead.
I was going to say that when I started practicing, I was in my 20s, mid-20s. So here I am, mid-20s, and people would come in and, I would say, hi. At the time, I was just Tanisha. I was like, hi, I'm Tanisha. I'm your therapist. They would lean back in their seat. Okay. All right. You got some questions for me? And I would be like, what? Let me show you who I am. Right. So they made an assumption that I wasn't competent because they assumed I looked like a little girl. Even now, sometimes clients will ask me my age, which I think is none of your business. But they ask those things, right? Because they want to know, do you have enough lived experience to help me? My lived experience, yes, might be able to help you, but what you really want to know is, am I clinically trained? Do I understand how this field works? Do I understand how the mind works? Do I understand how trauma works? Do I understand what coping mechanisms are? Do I understand how I can help you understand that better? Now, if everyone went to a therapist that went through their own experiences, that would be difficult because we work with clients who deal with a lot of issues. So that means I had to have gone through rape. I had to have gone through a divorce. I had to have gone through bankruptcy. I had to have, I got to go through all this for you to think that I am competent. Well, guess what? I'm probably broken. I don't know about competent because I don't know if I did my work, if I got all those things going on. So do you really want the therapist that has gone through what you've gone through, or do you really want a therapist who is competent in their skills?
There you go.
Say it loud. I'm trying to tell you that is exactly right. Exactly.
My first ever therapist I went to, he was a psychologist, and he put me under this hypnosis. To me, I don't know what he did because I fell asleep. I didn't hear nothing. So he goes, "Did you feel it?" Yeah. I don't know what I was supposed to say, but I figured he was a fraud because him and his son both are in prison now, for fraud. So I'm just like, so how much, work did he actually do for me? Or what he was telling me was actually true. But I mean, he was like you say, he was a psychologist. He referred medicine because he couldn't actually write the prescription. But now I'm thinking about it, putting me under hypnosis and all that. And I mean, I don't even think that worked because I'm like, this is a joke. I'm just over there in the chair wiggling my toes. And, do you think hypnosis is actually true and does it work?
So I've seen hypnosis work, but you definitely have to be with somebody that's trained to do it. But the person who is going for hypnosis has to be open to this can work, right? At the end of the day, everything goes back to our minds. Our mind has the capabilities of showing up and saying this can work, or if our mind says this is some fake stuff, then guess what? It's some fake stuff. So there have definitely been several studies that have shown the impact of people going under hypnosis for smoking and other addictions. And so it can be effective, but just like every type of therapy isn't for every client, hypnosis isn't going to be for every client. And so a lot of individuals have struggled with some type of trauma. And for adults, I don't think adults realize how your early childhood experiences show up in your adulthood. And so I talk about early childhood attachment styles because research shows that the most important years of a child's life is from age 1 to 5. And that is where the child is going to develop a sense of attachment, whether it's going to be healthy or unhealthy. And so we have 4 different attachment styles. And your attachment styles show up in your relationships. Either if you had a healthy bonding with your caregivers, then you're going to have a healthy attachment. If you had an unhealthy attachment, whereas the parent maybe showed up sometimes, but they didn't show up all the time, you have an anxious attachment style. If you have a parent that was just not there, you have an avoidant attachment style, which says, I don't know, I know you're not going to show up. I know you're not going to be there. So those early childhood experiences now show up in your dating pattern. So the person who has anxious attachments, these are the people who get in relationships and are really needy. Call me all the time. Where you at? What you doing? When you coming? Right? Because they're anxious. You're going to leave me. The avoidant style is these are the people who just don't get in relationships. And if they do get in the relationships, they end them before you end them because I already think you're going to end this relationship. So you have these different types of attachment styles that were created in the first 5 years of life. And people have no idea that this is what's showing up. And this is why I can't have this healthy relationship because I haven't, 1, identified my attachment styles, and 2, I haven't dealt with it.
I never even thought about that. That's deep. And going back to the hypnosis, like you say, the brain, I think I would have been more open to the hypnosis if it had been a female. But I'm like, okay, if he put me under, what is he going to do to me while I'm over here?
Am I going to be safe?
There you go. And I couldn't. I'm like, no, I'm not going to fall into nothing with you over on that couch and I'm here by myself. So I probably would have been more open.
And that's something, and I don't know if your psychologist was, I know you said he was a man. I don't know if he was a black man, a white man, I don't know.
Hispanic, I think.
Okay, Hispanic. So one of the things that's really important when people are searching for therapists is that, and typically you know by the first visit, right? If this is going to be a good fit or not. You want to make sure that you're talking to somebody that has created a safe space for you, right? And so there are some times where women who have had trauma, let's say it's been sexual trauma, they don't want to see men, right? They're like staying away from men because men aren't safe to them. That's the narrative that they've created, and that's fine. Now find a female therapist that creates that safe space, because just because she's a female doesn't mean she's safe either, right? Like you want to make sure that you find therapists that nurture what you need at that particular time based on what it is that you've experienced. And I know some awesome male therapists that do some really good trauma work with women who have been sexually traumatized, because they create such a safe environment that these women are like, oh yeah, you're the one I need to do this work with.
That's good.
And you don't realize how much thought you have to put into finding a therapist. Like you just broke it down to, most people just call up the first one that answer and has an available appointment, because I've done it myself.
Exactly. Like there are some questions that counselors, that individuals should be asking their therapists, right? So you want to know, obviously, what their license is if it's not posted somewhere online. And finding a therapist, the first thing I would do is ask for a recommendation, right? But here's what happens, I think, in our culture. We're still shaming therapy, right? So we're not open to always asking, hey girl, you know a good therapist? I hear more talk now, but I don't think that happens. So that's the first place to start. Ask around first to see if you can get a good recommendation from somebody that has been used by someone you know. If that's a no, okay. Now when you call and make these appointments, see if you can talk to them, right? Like think about what you get from a conversation. You can hear in people's tone, I ain't like that. I ain't like how they said that. Or, yeah, right? Just from a conversation. So now you're going to have this phone conversation. It doesn't need to be long, right? But you're able to ask them some questions. Now you want to find out, do you have a theoretical orientation that you practice from? That's a very specific question, right? If someone tells you, oh, I'm eclectic pretty much means they pull from multiple theories based on what they think is best for you, right? Or, for example, my theoretical orientation is cognitive behavioral therapy. I believe that in how we think, it impacts what we feel and what we do. So let's talk about these cognitive thought patterns. Right. So I'm very clear in how I communicate that to people. So those are some questions. Also, a question to ask is, so if I'm in a crisis, how do you deal with that? Right. Hopefully they're going to say, I'm going to get you to the first available place that you need to be seen. Because if it's a crisis, don't call me, call 911. But you still want to know, how do they deal with that? So there are some questions right out the gate that should be asked before just scheduling an appointment, because you have an open.
And another thing, back to the kids, like getting, what did you call it? A psychological evaluation for kids. Like it's so pushed out to where it's like, okay, you talking about 3 months away. What do we do in the meantime? And
right.
You don't know what else to do.
And that's the difficult part when you're trying to get something like a full-blown psych assessment from a psychologist. And definitely somebody who's trying to get a new appointment with a psychiatrist could be on a 6-month waiting list, right? Like that's how far back some psychiatrists are. But in the meantime, this is where you should be getting connected with a certified play therapist. Because some of the things that, if to the untrained eye, what looks like a diagnosis is childhood behavior, it's environment, it's learned, it's I'm full of energy. And if you're a child of color, then unfortunately you could possibly get misdiagnosed just because of how you're showing up, right? So I can't tell you how many number of children have been diagnosed with ADHD or ADD because the teacher said, well, he won't sit down, right? Well, is it he won't sit down, or do you have poor classroom management? So it's really being able to work with somebody who is a certified play therapist who can sit and actually work with the child, work with the parents. Because as a parent, you're just like, what? what do I do? Right?
Yeah, I'm like, he said here to do his work perfectly fine. Like he writes up and I make him sit down and write for 20 minutes a day. He don't get up, he do his work, he do math, he'll work to the fair and work a whole math book, but you can't. But I was like, maybe if it's all of this going on, I don't really know. That's why I said we need to figure out something, because whatever's going on is unacceptable. Yeah, and I'm not just going to lay to the side and watch y'all be like he just bad, because he's not. He's smart, and we gonna make.
And there's no such thing as a bad, like any. Bad. If a therapist, counselor, whoever you're seeing says a child is bad, don't make another appointment.
Well, we don't even have one. Like everybody we're calling. We don't
make another appointment because children aren't bad, right? Mm-hmm. It's a behavior that is showing up. And in order for, I don't know if people know, but if someone carries a diagnosis of ADHD, it has to be observed in 2 different settings. So parents have to give an evaluation with the therapist that says this, you're going off of this checklist, right? Mm-hmm. And then they have to do the same evaluation with the school in most cases when it's a child, because what you just said is what happens. The child shows up this way, that's off the wall of school, right? Yeah. And then they get home, they're like, yes, mother. Right. And you're like, so what you talking about my baby, right? So he's not showing up consistent in both places. In order for it to be a true diagnosis of ADHD, he has to have the same inattention, hyperactivity, both at home and at school, or at least in 2 different settings.
Mm-hmm. But you have ADHD.
We ain't talking about me right now. but for several years, and they admitted, as soon as I started talking, they be like, you bipolar. I was like, dude, I'm not bipolar. I'm trying to tell you, because I have a psychology degree. I may not have a master's, PhD, but I have the basics, and I know that I am not bipolar, because I don't go on long of anything. You have to have the mania. You have to have the hypomania or mania with bipolar. And the mania and the hypomania is a week or less with increased energy, without sleep, increased, I'm on top of the world, I can conquer everything, the world is great, I'm doing 50,000 things at a time, I'm not losing any sleep, and then there's a crash. So right after the hypomania or the mania, there's a crash, and there's depression that sits in for the next couple of weeks. See? And I had a psychotic break, but I didn't have all of that. And I was like, you're not even listening to me before. I mean, like, we have 45 minutes. In the first 5 minutes, you're telling me I'm bipolar. I was like, no. And then I asked for another therapist, and I said, I'm gonna let you keep this copay. But what we're not gonna do is schedule you for nothing else, because I'm not taking no more bipolar medicine.
But I know she's ADHD. She'll start the dishes, I'm just saying, and the dish will go something like, and then she want me to bounce around just like she doing, So
I get a lot accomplished, though. I get a lot accomplished.
Everyone who has ADHD say they get a lot accomplished.
I said, she talking about, when you come home from work, we need to clean this whole. I said, I'm not coming in cleaning up after work. I mean, I'm not doing it. I don't know how else to tell you this or what to tell you, but I'm not doing it. She be in her just the whole house just. Man, come on, it's 8 o'clock at night. I'm not doing that. And I get up at 3. Yeah, we're not doing that.
Anyway, I'm glad that you gave these recommendations for when people are getting a therapist. We're not talking about me. I don't mind talking about me, because I feel like several people have that same issue, because I've heard it like time and time again. That's the first thing they tell a lot of the women that I have encountered, bipolar disorder. And I'm like, oh, no, no. I told them, I say, you need to go make sure you get a second opinion. And I think that's a good thing to do, is to get a second opinion.
You can always get a second opinion. When you go see someone for therapy, part of it is education, right? So no one wants to just be told, well, you know what, you got bipolar. Versus, you know what, I noticed that you seem to present with this symptom. You talked about this happening. You mentioned this occurring. And so you're able to draw this roadmap of symptoms, right? And then in that roadmap, they're confirming, like, yeah, that's, well, based on what we described, based on what I heard you say, this is what it looks like. It looks like depression. It looks like bipolar 1. It looks like bipolar 2. But it's the explanation of how did you get there, right? Like, I know I sat here and I talked to you, but I don't understand how you got to that place with me. And so that education piece is really important for clients to know. How did you get to this diagnosis? And in order to have a diagnosis, there is a book I think many are familiar with, the DSM-5 revised now. And it has the blueprint. It says, in order to have bipolar, you need to have these symptoms. They need to occur within this amount of time frame. If that doesn't happen, then that's not bipolar. Possibly it is another diagnosis. So that's what is being used to provide these diagnoses.
So we talked about some things that people should inquire about when seeking therapy of, any type. And if you're joining the podcast right now, watch the beginning, because Dr. Guy explained the difference between a therapist, counselor, all the things under the therapy umbrella. But I'm sorry, excuse me. Now you got me over here choking. Dr. Guy, do you have any other things that you would like to tell the audience about this time of year that will help those those of us or everybody, anyone who particularly feeling blue? I don't know. I'm not sure of the correct terms or whatever, but not feeling themselves or anything that they can
know they're going, like she said, going to
even recognize this. Because sometimes, like when I was going through, what is it? After you had a postpartum
depression,
I didn't even realize it until like 2 years in. I was like, what in the world?
And I think that's definitely probably the place to start, is you said you didn't notice it. And so a lot of people don't notice it because we're so busy with our lives, right? That we don't take the time to realize, things haven't been the same until they get so severe to where you realize, you know what, the only thing I do is go to work. I don't socialize with my friends anymore. I don't talk on the phone anymore. I'm not watching TV. I've stopped eating. I've lost some weight, right? It's not until you begin to see those signs that you're like, maybe there's something wrong. And so a good place to start is a self-check-in, right? Like to check in with how you are doing. If you have to sit down and literally write, today I'm feeling X, Y, and Z. Like, it's easy for us to remove ourselves from how we feel. Because we go to work, we take care of kids, we have spouses, so we don't even connect to it, right? Sometimes I'll ask a client, how do you feel? And they'll say things like, okay, all right, or fine. And I ask them again, because those are not emotions. They're not feelings. I need an emotion. And so part of doing the work is checking in with yourself on a daily basis. How do I really feel today? I need to sit with that. Like, do I feel anxious? Okay, so let me write that down. What happened? Because anxiety is the fear about the future, right? When we struggle with anxiety, it's the fear of the unknown, or we're creating thoughts about what we think could possibly happen. So in many cases, we're already self-sabotaging our future before it even comes. So if that is the case, now I need to focus on, okay, what does it look like I'm doing to create this level of anxiety so that I can change it? If it's dealing with depression, like around now, the seasonal affective disorder that people might be experiencing, or the depression, or the S word, this is a time where it's really important to look after your loved ones and friends, because the people who notice the change in behavior first is us, right? And so sometimes people don't notice it, like you said. So stay in touch with the people who you care about, check in on them, call them, see what's going on. Are they showing up for different things that they used to show up for? When you talk to them, do they have a different tone? Do they sound sullen and melancholy, right? We're the first signs that something is wrong, because we can see it and we can talk to them about it. They may not want to talk to us about it. Depending on the severity that they're at, they might need to seek out professional help at this time. Right. And so a lot of people are going to go into these holiday seasons and they're going to do it in silence. And unfortunately, these are the ones that show up and they struggle with the S word, because the two things that go together for people who struggle with the S word is they have a sense of hopelessness and a sense of worthlessness. So anytime you hear those two words spoken by somebody, you guys know that those are the signs of someone who's struggling with the S.
And a question: if someone knows somebody that's struggling with it, how do they tell that person or get that person help? And I had a guy that I knew, and I knew he was going to commit the S. I seriously, I knew it. Just by the way he always talked, everything. But I lost contact with him. And then probably about a year later, I got the call that he had committed the S. But how do you go to somebody else? I mean, do you contact somebody, or how do you do that?
Unfortunately, the only person who, if they're an adult, let's say just a friend, the only thing you can do is really encourage them, support them. Hey, let's try talking to somebody. Maybe even make the phone call, set up the appointment because they're your friend. If it's maybe an adult child, depending on how debilitating their symptoms now are. But again, if they're having thoughts about the S, you can take them to the nearest psychiatric hospital and they can have an assessment. The assessment is free. If they have the assessment at a psychiatric hospital and the S comes up, then the hospital is going to admit them. Even if they don't want to, they can be admitted against their will, even as an adult, because they are now at a place where they're a danger to themselves or even possibly a danger to somebody else. So if it's an adult, they don't want to go to therapy and they're having these S thoughts, then the best thing to do is to get them to the nearest psychiatric hospital to be assessed.
Psychiatric. Oh, thank you for that. Oh gosh, I had a question. Oh goodness. Oh my gosh, it was wrong. Okay. For those people who fear being labeled, because Mr. Terry said something about this. This is on screen. Something about a fear of being labeled. Now, what I always say, I've been diagnosed with this, but that doesn't hinder me. That doesn't. It actually enabled me to better assess how I manage my life. You know what I'm saying? I did. Not knowing, I'm like, well, why am I feeling like this? Or why am I never getting anything done? Or why am I, all over the place? That was more debilitating than the actual, if you said somebody is, oh, you this, you depressed, what's wrong with you, or whatever the case may be. And so how can we reframe this, or how can we let people know that, it is okay to seek help, if whatever the quote unquote label is, diagnosis is, it's okay. That is to help, understand where you are, to help you get to where you want to be or need to be. Don't stay stuck in there just because you don't want to be labeled or diagnosed with something.
Facts. So one of the things that, and definitely in the field of counseling, is that we have removed is the word crazy. Because I think that, especially in the Black community, we have used that word so fluidly, right? Like, cousin Leroy, he crazy. So I think the first thing is we've kind of removed those labels such as crazy, and we specifically focus on mental health. Everybody has mental health. Everybody, right? And so I think people forget that. They equate mental illness with mental health. And so we talk about mental illness so that you can improve your mental health. So getting a diagnosis doesn't make it worse. Getting a diagnosis says exactly what you said. Now I know why this is happening. Now I can address it. Now I can improve it. So if we can refrain from the verbiage that we use, things like crazy, and understand that my mental health is important, just as important as my physical health. Everybody has a mental health. This isn't just me, this is everybody. But everybody doesn't have a mental health illness. But if I know what my illness is, I can improve my life. I can do things about it. I can change it. I can redirect how I'm spending energy. I can reframe my thoughts, because most of the work that we deal with in counseling is helping clients reframe how they think. I think, therefore I am. Even the terms when clients will say in and say, I have depression, right? I am depressed. So one says, this is a diagnosis and I understand this. The other says, this is who I am. Right. And so you're not a diagnosis, right? Which is why I chose the field of counseling, because in counseling, we work from what's called the wellness model. The wellness model says it doesn't matter what you're dealing with. You are not a diagnosis. You are a person. Our diagnosis helps us understand what your symptoms are. So let's treat the symptoms, because your symptoms are separate from who you are as a person. You aren't bipolar. You have a diagnosis of bipolar, if that was the case, right? So the ownership in this diagnosis looks very different. It doesn't control me. I control it.
I love that. I love how that was eloquent. Very eloquent.
And it's going to open people up to where, like you say, the stigma and people are more, they would be more open to getting help instead of just sitting around suffering in silence, as I call it.
And I say, you know what, the words that we say are so critical. And I'm constantly trying to think before I speak, because, you know, you sometimes just, you know, have diarrhea at the mouth. And so, you know, because like you can't take that back. You can't take it back. And people, I say, you know, people steady say you're struggling with this. I'm broke. I'm this, because your actions will follow your focus. So what do you focus on? And if you focus on something, that's what you tend to talk about. That's what you tend to. That's how you tend to surround. You know, who you surround yourself with, and what do you do? And that's why I was telling somebody, I said, they were single, they've been single for a while. And I said, you know what do you like to do? What do you like to do? You know, and I was like, I don't, and people ask me, what are your hobbies? I'm like, I don't know. I go to work. I don't know. They don't have any hobbies. But I said, you have to get out of that, like just, good times scratching and surviving. I said, no, I'm not in survival mode. I am in thriving mode. I am going to live this life like it's supposed to be. But I there was not even a question in there. But I'm just like,
it's okay. I think one of the maybe this was kind of the. Did you want me to answer?
I did want to go there, but if you want to talk about what I'm
gonna go with what you said and then answer the question.
Right.
Everything does start with our mind, right? And so for people that are believers, right, the idea that, in particular for those that believe in the Christian doctrine, that all of this that we see was made in the likeness and the image of a creator. And it wasn't made because the creator waved a wand. The creator spoke this into existence. And if I am made in the likeness and the image of my creator, then I have the power to speak things into existence. So I either speak positive or I speak negative. I speak life or I speak death. The words that come out of my mouth are the words that dictate how I show up in this present. So when people use negative terms, they have already set the tone for the day, the week, without even realizing. But the problem is, because of past experiences, they have now created a narrative that is negative. The narrative is people don't show up for me. The negative is that nothing good is going to happen to me. The narrative is that I'm always going to be broke. Once that narrative is changed in the head, it changes coming out of the mouth. But this is why journaling is so important, because there is something that takes place when you put good old pen and paper to a journal. It turns your world around. And people, I tell my clients about this in the beginning. They're like, I got to get a journal. Absolutely. You can't do work with me without a journal. You got to put it to paper. When you put it to paper, and I can't stand these millennials that be like, oh, I'm going to type it. No, ma'am, you're not going to put this in your phone. It's paper and a journal. You're going to write this down. I don't know what it is. If it is in the atmosphere, if the creator said, let it be so, wrote it on the 10 Commandments, I need you to write it in this journal. Some of the things that we need are not external. They're internal. We just have to understand how it connects, how it lights fire. It's almost like two sparks are there, but when we say negative things, the sparks move away, like further and further away. But when we think positivity and negatively into ourselves, it gets closer and it ignites. And once it ignites, it's on fire. That is the only difference, that people who show up successful understood that they had to think successful.
Thank you. Thank you.
I think, therefore I am.
I think, therefore I am. Every single morning, everyone should have some positive mantra. And it has to start before the negative start, because the negativity is on autopilot. The negativity shows up and lives on our head rent free. So before that starts, the first thing you do is you wake up with your positive affirmation. And for some people, that is such a struggle. And if that is, it's okay. Write it down. So the first thing you're going to do is read it. and you're going to start reading it and continue to read it. And the next thing you know, you're going to wake up and you won't need to read it. Every single morning I wake up and I tell myself literally before I get out of the bed, I am positive energy. I am wealthy. I am healthy. I am love. Done. This is how I start my day.
Yeah, I do too. Even if I get out of bed, I start my meditation too. And on my Calm app, this is so funny because it'll tell me, after the meditation, it'll say, how do you feel? And I kept noticing, and it'll give you a chart on, like a thing.
How do you feel?
And I was like, I've been feeling tired. And then all of a sudden, well, I'm just saying, I got to take that time for myself. And I said, I feel tired. And one day I looked and it said, you feel content, you feel grateful. And it started changing. But it took that consistency and training my brain, it's not even the retraining the brain. It's like a programming. I don't even know. I guess that's retraining or whatever.
Retraining the brain. Yeah, that's what you're doing.
It's like it's like how people say I'm sick and tired of being sick and tired. I said that's when you know you're ready to do what you're gonna do. And until that, I don't know what to say. Just keep on. But at some point you gotta get tired.
When people are ready to make the pivot, they're sitting in their pain and they're like, you know what, my pain shows up every day. Absolutely, because you have a conversation with your pain every day. But the minute you decide that I'm sick and tired of being sick and tired, your pain will turn into your purpose.
Yes. Oh my gosh. Ooh, that's gonna be a clip. God, dog. Okay, wait a minute. Let me tell you. Okay, I gotta calm down. That was so good because I wish I didn't have a comment up there. So I like to take little clips and put it out as little short videos so people can, get
advertisement.
Okay.
Well, I'll definitely answer his question.
Say that one more time. Hold on. Say it one more time because I love that. Hold on, Miss Terry. I'm gonna bring your comment back. Oh gosh, I forget this thing is not touchscreen. Okay, hold on. Okay, now can you say that one more time? As soon as you stop replaying your pain, because we can tell you some pain points, right? Ask somebody what's their pain, baby, they're gone for years. So stop replaying the pain and start turning your pain into purpose. Turn pain into purpose. Woo, that sounds like a title of your next book, Doctor. Okay. Okay, now going back to the question, I'm sorry. And he says, question, Dr. Guy, I've talked about receiving professional mental health services on several YouTube channels. I found the biggest problem in people receiving professional mental health is, where's the second part?
Is it the affordability?
Therapists and psychologists rush to a medical solution without teaching life skill solution. What is your criteria for going to a mental health solution is needed?
Therapist, psychologist, rush to a medical. So I want to make sure that I'm understanding the question. So are you asking, are therapists and psychologists quick to say that this is a medical issue and to push you off to a medical doctor? And so is that the question?
No,
because
I'm thinking he said they're so quick to just rush and give him a diagnosis without teaching him how to cope, like he was saying, without the medication.
Oh, okay. So let me explain why the diagnosis has to come into play. If someone chooses to use their insurance company to go see a provider, that claim should be submitted within 24 to 48 hours. But in order to submit a claim for insurance reimbursement, you have to have a diagnosis. I don't know if people know that. So
no, I didn't.
You have to have a diagnosis. Now, if you're not using insurance, then there's no reason to have to, necessarily rush to get the diagnosis accurate. But once you've worked with clients for so long, when people start to talk, you hear the symptoms. You're just going through it in your head. Check, right? And so you might not know that, but they know that. But this is where that education piece goes back to what I talked about, is explaining, okay, so it sounds like you're struggling with this, and this is the reason why I heard you say. So I'm literally going to repeat to you what you said, but I'm indicating that this is the diagnosis for anxiety or whatever this particular diagnosis is, so that you don't feel blindsided. And even if you are given that diagnosis and you now know it, it doesn't change. Doesn't make you less of a person, doesn't make you weak. It just means I understand why I'm having these symptoms. Now let's do something about it. And I think people have to move past that place of feeling like there is a stigma if I have a diagnosis. And so there's a huge population of folks that are like, I got diagnosis, I talk about it, and this is what it is. People of color, we're still not there yet. We're still not there yet. So we got some more work. That's why podcasts like this and his that are talking about mental health are so important, because we still are working on decreasing the stigma against mental health. The more you know about mental health, the better you are at preventing mental illness from happening.
Thank you.
That's important. And I don't know if that other part of his question was about like, how do people get resources for counseling? I always suggest going to, if you're currently working, you can go and check and see if your employer has an EAP. It's the Employee Assistance Program. Typically, it offers you 3 to 6 sessions, depending on who the employer is, at no cost to you. One of the things that a lot of people don't know is that your EAP benefit is for anybody in your home. If Cousin Pookie come and stay with you for 30 days and is driving you absolutely insane and needs some help, Cousin Pookie can use your EAP benefit.
Oh, wow. I know that.
Help, right? Anybody who is staying in your home has access to your benefit. So if you got 5 visits at no cost, Cousin Pookie got 5 visits at no cost, right? So start with the EAP. Always check to see if your employer has an EAP. If you're not working, check on Psychology Today. This is a page where you can find providers in your area based on zip code. There's photos, there's videos, and you have a criteria of what their specialty areas are. This is what they treat. These are their license. These are their degrees. This is how long they've been practicing. They might even have a video clip so you can kind of get a feel for their tone. Those things are helpful. But the reason why I'm suggesting go there, because they have practices like mine. We have a sliding scale or a reduced rate. So for people that might say, I don't have $100 and something to pay for a session, great. We have much affordable rates. There are other practices that do pro bono. We do pro bono, right? So you never know until you reach out. There are agencies that are having sessions for $15. Universities have clinics where sessions are $15. People just need to know where these resources are so they can take more advantage of them.
And that was good information, because people don't know what you just said. I mean, a lot of people don't know they can find it pro bono for $15, $20. I looked at one and she wanted $450. I said, what are you telling me for an hour that's going to cost me $450? I mean, you coming to stay with me overnight? I didn't mean it in that way, but I'm just
$450.
$450? Yeah, come on now. That was just a bit much, you know.
That's good to know. So you said Psychology Today.
Psychologytoday.com. And you can search by zip code, but then once you pull up the zip code, you can search and look for people that look like you.
Awesome. Okay. And one quick question. Are you accepting new clients, just in case? I'm asking for
your phone will be ringing out the hook. She said she's
Are you accepting new clients?
She said she's
I am not accepting new clients. I have counselors at my practice that are accepting folks, but I am transitioning out from seeing clients completely for mental health to working with my therapist so that we can provide more competent therapists in private practice to do what it is that we're doing.
You're coaching.
Thank you.
You have to already be licensed to get in your coaching academy, because you're CEO of a coaching academy, correct?
No, you don't have to be licensed. Like if somebody knows this is what I want, I'm preparing myself to start a private practice, then I'll work with them. It's anybody who's looking to start a private practice, a clinical private practice. I have a program that's 90 days that literally walks you through the process, which is why I wrote the book, Private Practice in 30 Days, because you can have a private practice up and running in 30 days, seeing clients.
Okay, so I think he clarified the question here. So let me see. Okay, here we go.
Okay.
I'll let you read, because when I read out loud, I'm like,
I don't have my glasses. That's the same one we just did, isn't it?
I think he was just clarifying it though.
My question is, what is your standard for providing a medical solution? I found a lot of times mental health issues come from a lack of life skills and person not being taught how to deal with them.
With their emotions, he said.
Okay.
Deal with their emotions. Okay. So I don't give the medical realm is not my wheelhouse. I'm not trained. I'm not qualified. Anything that's showing up that's a medical issue, I'm referring you out. But my wheelhouse is teaching clients how to deal with emotions.
Mhm.
And so I want to say this is that when a client comes to me for the first session, I would always explain to them that I don't have any anecdotal or research to support this, only my 22 years in clinical practice, that I believe in a creator that gave us the ability to do three things. He gave us the ability to think, he gave us the ability to feel, he gave us the ability to do. We're born with these gifts, but over time, because life happens to us, we become fragmented from our own selves. So we lose our ability in some cases to feel because we experienced something that was so traumatic. We didn't like the pain and we decided, I don't want to deal with those anymore. So we put our little emotions in a box and we close it. And we continue to function in life, but not dealing with our emotions. Then we have these people that are thinkers. My thinkers live in logic world. 1 + 1 will always equal 2 for my logic people. But my feelers are over here saying 1 + 1 = 7, which doesn't make sense to the logic people, but that's the lane that they live in. And so I have my thinkers that are very straightforward, straight to the point. My feelers are my empath. They take on every emotion. They can walk into a room and feel every emotion that every person is experiencing in that room, and it's intense. My doers are the people, they're life of the parties. They get things done, but they can also be impulsive because they're so action oriented, they don't necessarily think. In order for us to be our healthiest selves, all three of those parts have to be working together. But unfortunately, by the time you get to therapy, you are already fragmented from self. The person who has an issue with dealing with their emotions is fragmented from their feelings. They don't talk about it. They don't deal with it. They want to lock them up as if I don't need them. But to be truly authentic and healthy, you have to embrace how you feel, how you think, and what you do.
I like how you did that. Like, I love how you said you need to check in with yourself each and every day, because like I said, and then when you write it down, you can actually see like, oh man, I'm stuck in this spot. I need to do something about this. I'm here. And I love that. Get the journal. I tell her that I'm telling her all the time. She was thinking,
get a journal. You get them journals will give you a breakthrough. You'll look back 30 days, a year, and be like, man. Journals
I have mine from years, and sometimes I look back and I'm like, man, how I have evolved. You know what I'm saying? Because I used to hold on to grudges, and I said, you know what? At some point, you gotta. I'm gonna forgive this person. Go on, like kind of move on from this situation because they still winning. Like you're not gonna keep me. You like, if I still have not forgiven you, then you still winning. You still have power over me, and that don't belong to you. You know what I'm saying? So I got to get my strength back. I got to be. You know what I'm saying? And that comes from, it just like lifted a cloud. You know what I'm saying? And I know I know it still happened, but ain't no need for me to continue to dwell on that. And everybody, I say, this person probably did X, Y, Z. They probably hurt, because they say hurt people. So they probably dealing with something. You know what? I do not have time, because I can go on. I'll be holding on this for 20 years. And then have it move forward, and this has held me from moving forward and actually living my life. No.
And forgiveness isn't for the other person, which people seem to often say, I'm not going to forgive that person because I'm not going to give them the benefit, the satisfaction. But that's not what forgiveness is for. Forgiveness is for you releasing that energy, because we're made up of energy. And if you hold on to that energy, that negativity, it literally eats you from the inside out, and it shows up in everything you do. It shows up in your physical life, which is why so many women, I hate to say this, struggle with constipation, because they cannot deal with those emotions. And instead of them dealing with them, they shut them down, and it shows up as a physical constipation in the body. Forgiveness is really the key to getting connected again and stop the fragmentation.
Woo! So as we begin to close out the podcast, if anyone else has a question please go ahead and enter it into the chat. Dr. Gray, why I want to call you Dr. Gray, Dr. Guy, I apologize. Do you have any final words for our audience and those who will be watching this on the replay?
Final words is counseling, therapy, all of that together. It isn't a miracle fix, but it can be the start to healing. And healing is an ongoing process. It's not healed, it's healing. But sometimes you do need an objective party that is able to assist you. And I don't have all the answers, right? I don't give advice as a professional counselor. What I do have is an understanding of behavior. What I do have is an understanding of past clients' experiences. What I do have is an understanding of my theoretical orientation and how to apply that with you as a client to help you reach the goals that you want. And if you can find the right one, the one that aligns with you, the one that does what you need in therapy, you can definitely make some breakthroughs.
Oh, that is good.
This whole podcast, I feel, is going to help a lot of people, especially with resources, because now people can search in silence and don't have to go out and try to pick people's brains to let them know what they're going through. By being able to give them the websites and the information, they're able to do it incognito at their own time, at their own leisure. And that's what our podcast is about, is putting it out there so people can get the help that they need.
And I say, hey, if you need to talk to somebody, you go ahead and who cares what these folks say, because they're not paying your bills, they're not doing none of that. If you have a question, she said, ask some recommendation. You know somebody, hey, but like, who do you see? Well, they may have somebody in their office that they may be able to work with. Because let me tell you something. If you think everybody is just hunky dory, because I walk through the world and I just be like, they be like, why do you stay so happy? Because I done woke up this morning. I have a purpose. God has a purpose and a plan for my life. And if they don't make, I snap. I get a little testy at times. But overall, I feel happy. I feel just it's just a joy to be alive. But it took a lot of work. And I see a counselor and a coach every week. Like my job operator, sign me up. I see a personal. I talk to a guy, actually to a personal trainer. Whatever else y'all have, I want to be a part of that. Like take advantage of the resources that you have available. Do not be ashamed. Like you said, you can get it in private. But if you need to, just go ahead and ask. You can contact your HR person if you don't have a job. Contact, I don't know, what is it, 411-211 Psychology Today, wherever you got to go. I don't know. I just said, don't be confused. All these 644. I said Psychology Today, but what I don't want, like you said, now they can do it behind the closed door. They're saying, but don't. Yeah, go ahead. What you think?
There's some that are going to do it. Not everybody is that open to just go and,
But we are here to stop the stigma.
Yeah, because I call myself thrown off. They go walk up to you, throw it off too, But we got to stop the labeling, and that's probably why.
Exactly.
And everybody, like, I cannot stress enough that people who go to therapy are people who want to get better. That's it. They're not crazy. It's not about an illness. It's just about people want to show up as better versions of themselves. I am a serial client. I will forever have a therapist because I understand the impact that the therapist has in my life, which allows me to have a greater impact in my client's life. So it's not for just a certain group of people. It's not for white people. It's not for Black people. It's not for women and not for men. It is for everybody.
Everybody. Yes. You heard it. That's
and we wanted to actually do a whole family therapist. We had talked about it, doing a family therapy, because we are living in a different situation. And I just came in about a year and a half ago, so this is totally different. We got a book that's called My Mom the Best, and the little one will say, well, I got two moms and they're both the best. I said, that's my biggest fan right there,
Right.
But we do need that, because you can't say that they really understand everything, because they are 5 and 8 years old. And you just want to make sure that they know that it's okay to do the opposite of the way we're living. Does that make sense? You don't want them to think that they have to live this way when they get older.
And I pray. I explain, and I explain to the best of my ability. And I know that that's good. I mean, because we have a dynamic situation, but they see different. Like their godparents, have been married for 18 years, and my aunt has been married, and we have people who've been divorced, and we have people who've been remarried, and we have us, and we have these different situations. And I said, that's the beauty in the world. Everybody's not meant to be alike. If everybody were alike, then there would be no diversity. There would be no uniqueness. It'd be just bland. Life would be bland. So you have to just find peace with yourself. And they 8 and 6, they meditate. They meditate. Because you have to you got to get the world out of your head and just think and let this your energy rest. You know. I'm sorry, go ahead.
And can I give a plug for, because we were talking about certified play therapists.
Yes.
Dr. Elena Anderson, she is an African-American certified play therapist in Cedar Hill, Texas.
Ooh,
And she is taking new clients.
Yes, definitely. Dr. Elena.
Dr. Elena Anderson, she is a certified play therapist in Cedar Hill, Texas, and she's taking new clients.
Thank
Perfect.
you. Okay.
Appreciate that for real. We'll call her Monday.
Yes. Thank you so much for being here. Thanks everyone that is in the live chat. Thanks to those who are in the bushes. Thank you for those who will be watching this on the replay. Please share this podcast because you may not say that you may not need therapy or whatever the case may be, but someone in your circle may be saying, I wish I knew a way to get therapy. And Dr. Guy has just provided us with a plethora of resources and just breaking down what is under the umbrella of therapy. So if you did not see that portion of the podcast, go back to the beginning because it was thoroughly explained. So we appreciate you all being here, and we will see you all in the next one. Peace. Oh, I got